Access to affordable therapy and counseling in my local community. Introduction. My name is Elonna Armstrong, and I am interested in my local community's issues, particularly in improving access to mental health services in my local community. A lot of my direct, close family live in Findlay or very close to Findlay and the surrounding area. With that in mind, I have observed significant challenges in accessing affordable therapy and counseling services. In addition, Katie helped to support my stance while providing me with crucial information about the mental health field in Findlay, Ohio. Context. My local community is in Findlay, Ohio, which is located about 10 miles outside of Rawson, Ohio, my hometown. Findlay, Ohio, which is known for marathon and characterized by diverse demographics and socio-economic backgrounds. Findlay, Ohio was also a safe stop along the Underground Railroad and later became known as a booming center for natural resources like gas and oil. Some norms in Findlay include attractive business culture, cooperative and innovative community. In addition, Findlay is a community for all to belong. Findlay has been listed as one of the top 40 dream towns in the United States for its strong economy, moderate cost of living, well-educated population, manageable traffic, and ease of access and transportation to many urban areas. Justification. The issue of access to affordable therapy and counseling in my community is critical due to its high cost of sessions, limited insurance coverage options. In other words, some providers accept Medicaid but not private insurance and vice versa, and significant stigma surrounding mental health issues. These specific issues need urgent attention to improve mental health outcomes and to reduce overall disparities. Audience. My target audience is community members, local healthcare providers, and policymakers. They should be interested in my community issues because improving mental health services enhances overall community well-being and productivity. Lastly, they should also be interested because improving mental health services can help to reduce healthcare costs in the long term, which promotes productivity. Document purpose. The purpose of my presentation is to raise awareness about the challenges and barriers of accessing affordable therapy and counseling in my community and to advocate for the establishment of sustainable, low-cost therapy options in Findlay. By sharing this information, I hope to inspire actionable steps towards improving mental health support locally. Findings. From interviews and research, it is very clear that therapy costs are prohibitive for many without insurance, and there are challenges even for those with insurance due to things like copays and deductibles. In addition, stigma remains a significant barrier to seeking mental health treatment despite increasing awareness, perpetuating a cycle of unmet needs and untreated conditions. Assumptions, pitfalls, challenges. Some assumptions for my community issue would include high demand for mental health services and the steady need for more providers willing to accept Medicaid. Some challenges in my local community would be addressing stigma, navigating the complexities of ongoing insurance policies, and overcoming cultural stigma associated with mental health issues. Proposed solution. I propose advocating for the establishment of more low-cost therapy options in our community. This initiative should focus on increasing Medicare acceptance among providers, promoting sliding fee scales based on income, and fostering partnerships with local healthcare providers and community organizations to expand overall access. Implementation steps. To implement these solutions effectively, I plan to collaborate closely with local healthcare providers, mental health advocacy groups, and policymakers, if need be. Community outreach and education efforts will be a crucial step in raising awareness and garnering overall support for my issue. Securing funding through grants and partnerships can also be an essential component to sustain these initiatives in the long term. Benefits. The benefits of implementing these proposed solutions in mind include improved mental health outcomes for community members, reduced stigma surrounding mental health issues, and enhanced overall community well-being. By investing in affordable therapy and counseling options, we can create a more supportive environment where individuals feel comfortable and empowered to seek help when needed. Challenges. Some challenges in my local community issue would include securing adequate funding to support the low-cost therapy initiatives and overcoming resistance from some healthcare providers who may be reluctant to accept Medicaid or adjust their fee structures. Mitigation strategies involve community education, engaging in ongoing dialogue with stakeholders, advocating for policy changes that support mental health parity, and highlighting the economic benefits of investing in mental health care. Conclusion. In conclusion, addressing accessibility to affordable therapy and counseling services in my community is not just a moral imperative, but it's also a strategic investment in my local community's health and overall prosperity. By working together to remove barriers and expand options for mental health care, we can build a more resilient and supportive community for all of our residents.